Hi, my name is Mike Cantone, and I'm the political director for Organize Now. And we are here because we know how important Medicaid funding is to our many neighbors who are seniors, children, and people with disabilities. Adequate Medicaid funding ensures that our folks have access to the kind of care we expect in times of need. Whether it's an extended stay at a nursing home, a quick visit to a doctor's office, inpatient hospital care, or access to services that improve the lives of people with disabilities, it's no exaggeration to say that Medicaid-funded care is a lifeline to thousands of people here in Orlando. If these benefits falter because of actions in Washington and because of actions of our Congressman Dan Webster, it would devastate the people of Orlando, damage our state budget, and deal a blow to our local economy. Medicaid is already under the gun because of funding cuts passed by the Republican-controlled House of Representatives, which Congressman Webster did vote for and continues to publicly support. Seniors will be the big losers. Seniors and people with disabilities make up 1/4 of Medicaid enrollees, but account for 2/3 of the Medicaid spending. Cutting Medicaid is the last thing we need. I will now introduce Tamika Pierce, President of Organize Now, for a short statement.
Hello, my name is Tamika Pierce, and I am here because I am personally impacted by the actions Congressman Dan Webster is taking in Washington every day. For 5 years, I have been using Medicaid. I was diagnosed with systemic lupus and kidney disease, stage 3 kidney disease. And without Medicaid, I would not have been able to receive chemotherapy, which was IV and also pill form. Without Medicaid, I would have died. And as of 3 days ago, I was also told by my neurologist and my nephrologist that I have kidney disease again. So I need Medicaid. I usually attend Congressman Webster's town hall meetings because his staff says this is the best way to talk to my representative. But he has not answered my questions directly and has not lived up to his empty promises along the way. I decided to come and find him early and got some answers, so I hope he could actually listen to the people and offer solutions, not more rhetoric. Congress is getting ready to cut and deal to pay down the country's debt for taking away my Medicaid. I want to know why Daniel Webster wants to take away my health care instead of cutting loopholes for corporations and tax billionaires to pay down the deficit. Thank you.
Thank you, Tamika. I'd like to now also introduce Gracie Fowler.
I'm here today to talk to Congressman Dan Webster. My children have Medicaid. I had Medicaid for a couple of months when I had no income, but now I won't have Medicaid again. I'm a single mother, just graduated from college, and I don't even see how, with the jobs that I'm after now, that I'll be able to afford health insurance anytime soon. So I'm just out here to push back and say stop it with all the crap that's going on everywhere. Yes.
Perfect. This plan unfairly targets our most vulnerable populations, the elderly, people with disabilities, and low-income children. Moreover, eroding our social safety net will undermine the economic security of struggling families across America and here in Florida. Directly or indirectly, the middle-class majority will suffer without affordable health care. We're here to say to Dan Webster, don't support massive cuts to Medicaid and keep America's promises alive. Thank you.
I saw that.
A little bit. So he will not even look us in the eyes when we are pleading for him for life-saving policy. We're begging for him to be our seat at the table. He will not even look us in the eyes. So I want us to remember that when we go inside.
Oh yeah.
Because this, I mean, it can be fun to get riled up. It's important to bring truth to power, but honestly, this is life and death. Tamika just said if she did not have Medicaid, she would die. There are people who die because they do not have health insurance. Right now, I do not have health insurance. I cannot afford to see a doctor. So this is very real. So remember that when we go in, be emboldened, ask your questions. If he does not answer your questions, feel free to say, you know what, you did not answer my question. This is not someone that we have to cower to. This is someone who is responsible for us and for our voice at the table. So at this point, should we take it in? Let's take it in.
So anyway, here we are. And I'd be glad to answer some questions, and maybe we can discuss other issues. I came with the one I thought was the most important, but there are many other major issues that we're facing. So does somebody have a question? Yes, right back here.
My name is Marty Rich. Thank you for being here today, Daniel, and giving us an opportunity to ask you questions. But I'd like to take my opportunity to just make a statement today about how I observe what's happening. And in Wisconsin, we're seeing where teachers are being blamed and unions are being blamed. We're seeing in other areas where we're starting to blame a lot of the illegals coming into our country and being a problem with our health care. And we keep wanting to put the blame on all these poor people. But I really don't think that the problems that we're experiencing right now is a cause of the poor people. I really think that they're the ones being a victim, and our great country has always looked out for the poor people. And I would hope that you will continue to do that as you represent all of us. When we had our last depression, and Herbert Hoover was our president, and he didn't want to have any government programs for getting people back to work. And Americans really suffered a great long period of time. FDR came in and put Americans back to work. I really think that right now we need to, as much as we're in a financial problem, and I really believe the Republicans, by going to war and not paying for it at the time, put us in a bad situation. But our president needs to be able to fund for our roads and our bridges. We need to get those jobs moving right now. And as much as it hurts us to borrow and spend that money, we need to do that right now until the economy can recover. That's what I want to say. Thank you, Daniel.
Thank you, Representative Webster. And you're right. I think if a lot of people do what you do and sacrifice, it does add up. Because people sacrifice every day by not having health insurance. I don't have the wages that you do to be able to afford to not get insurance through an employer. And so, I brought this issue to you at the beginning of the year when I came to your office at your open house. And I asked you what you're going to do about the hundreds of thousands of people in this district that don't have health insurance, and kind of, stumbled over some words and split off. So I guess you didn't have time to speak to me. And your staff said this is the best place to get answers from you on things like health care. But right now, I don't have health care. I can't afford going to the market on my own. I work hard every day. My employer can't get approved for a health care package now because it's not enough of us. Your staff said that we should go to pecan clinics because it's a good partnership between public and private, and you felt like it was a good plan and we need to see more of that, and I did just that. Because without getting the medicine that I need, I can get more complications and possibly, not live. I went to a pecan clinic in my community, and I went at 7 a.m., and I did not leave until 6 p.m. And the only thing that I needed to do was have someone do a small check and give me a prescription. That doesn't feel like a good enough plan for America. And so I want to ask you, what is a good plan, besides everyone just suffering a little more to balance the budget? What is a good plan for health care? Because we need you to come up with that.
Well, we can pay for everybody. We can just do that, cover every expense of everything, just pay it, and we would last another couple of years, and then we would not have anything. This country would go down. So we've got that, pay faces, and that's what I'm trying to tell you. We only have 58 cents of money to pay for this. So we're already gone way beyond what we have. Okay, that's what we're doing. Just a minute. Way beyond what we're doing. I think we suggested he has I had the ability to start that when I was in the legislature back in 1998. And out here in West Orange. It's got the state to give the money to do it. It now operates and covers 125% of poverty, about what the Obamacare is going to cover, and it does primary and acute care. It does up to 200% of primary care, and to me, those private-public partnerships are far better than the cookie-cutter approach that the federal government uses. They have cookie cutters, and they say, okay, the problem and the solution for Ocoee, Butte, Montana, inner city New York, is the same. Take it or leave it. And that's wrong. We ought to be deciding locally. We ought to be able to take ourselves locally and determine what the needs are and then try to meet those needs. And that's what we've done. So if that's not good enough, that's where it is. That's what we can afford. And you know what? We're doing it without any extra tax money. They're leveraging Medicaid, and it's working out for them. And we're covering up to that point. If it took a long time to get seen, it takes a long time to get seen in the regular doctor's office too. And so just know it does. So anyway, that's the best we can do. If that's not good enough, then you'll have to get somebody who wants to go out and borrow 50 cents or $1 on every dollar. You know, that's what we'll have to have. Okay.
Thank you, Congressman. I've tried to ask this question in numerous town halls, and I appreciate you being here to answer questions, but it seemed like, before I even get to my question, I'd just like a clarification that you essentially did not use any figures or formulas for your charts. So are these simply here to make political points, or are you here to make a real argument on solutions for America? And I'd also like to just point out, I've heard numerous questions that I haven't heard a direct answer from you, and that is, what's the difference when you're calling on Democrats in Congress to make concessions? How come when the Republicans will draw a line in the sand and threaten to literally refuse to pay our debts and default this country, why we can't come to a real compromise with adults in Washington and put everything on the table, including revenue increases, along with, I've never heard any Democrat in Congress say that there will be no cuts whatsoever. In fact, I've heard larger cuts than we would prefer. So I'm wondering why it has to only be a one-side street and where your interests really lie. And again, I'd like to know where this formula or figure came from.
So which one are you talking about?
Is this the same one he always passes out?
Getting debt under control. I'd actually like, I know you cite the CBO, but I went on their website and actually found out that these charts do not match.
No, we use their numbers. They have things like this. Okay, see this?
No, I can't.
Well, it's figures. That's what CBO has. You can translate them because this. Okay, so in this document, there's fiscal year 2012, 13, 14, 15, 16, and you can just take that, put it on this sheet of paper and grab it.
But is that a responsible thing to then predict 100 years or 60 years from now and have a chart go off the graph? I mean, I just want to know where we hit this 200 debt limit, which, by the way, you have no figures on what this even stands for. I'm just very confused at why.
Guys, did your homework.
Well, this is a percentage of gross domestic product right here. These are years. I assumed you could guess that these were years, 1940, 1945, so forth. So now you can guess that those are years. And
yeah,
so,
I like how you point out the deficit during the Reagan years as well. That's which is your very first.
So this is where we are. And this is plotting the course of, because when the CBO scores something, they don't just plot the first year.
Where's the Obama budget come from? Those figures that shoot it off the chart.
Those come from a CBO extrapolation.
Sure, we have to get that from this.
I have no idea.
So you have no idea where the data you're presenting on came from?
Yes, I do. It came from
can't
numbers
provide that.
based on CBO.
Can you provide that to your constituents or no?
I can provide you this. This is the data.
I would like to see the hard data. Is that impossible for you?
I don't think so.
You cannot produce hard data?
No, I said I don't think it's impossible to do.
Can I call with a specific staffer from your office to get that information?
Well, why don't we see if we've got it, and we'll get back to
I
it.
did
If
ask
you'll-
at the
if
last
you'll-
town hall, and I see your staffer in the back that I talked to, and she never emailed or called me back.
Okay, great. We'll see what we can do.